Hi there, and welcome back to The Healthy Beat, the show where your heart health goes from to heck yeah, I've got this. Today I have two experts with me in the field of cardiovascular health. This is Nurse Sydney.
Hi.
And here is Nurse Abigail.
Hello.
We're going to dive into a topic that sounds super fancy but could affect millions of people: aortic stenosis. Say it with me: aortic stenosis. Let's break it down beat by beat. Okay, Abby. Question number one goes to you. So what the heck is aortic stenosis?
Imagine your heart is like a house. The valves are the doors. Aortic stenosis happens when one of those doors, just like the aortic valve, gets super stiff and narrow. It's like you're trying to squeeze a fire hose through a straw. Your heart now has to work overtime to pump the blood to the rest of your body. It's not cool, and it makes very much damage on the heart.
Yeah, not cool at all. Sydney, I need a refresher. What exactly is a valve again?
Yeah, so valves in the heart are like flap-like doors that open and close to control the blood flow. They even make the iconic love dub sound of your heartbeat. But when it starts malfunctioning, Houston, we've got a problem.
Okay, Abby, so where is the aortic valve?
The aortic valve is like the final exit ramp for blood leaving the heart, between your left ventricle and the aorta, the biggest blood vessel in the heart, or in the body. It's like the main gateway on the freeway to your bloodstream.
Can you show me where it is?
Yeah, so here we have the two left atrium and ventricle, and the right atrium and right ventricle. Right around the middle, near the left atrium, is the aortic valve.
Interesting. Okay, Sydney, can you tell me what causes aortic stenosis?
Yeah, so there's multiple things. So there's things such as like aging and calcium buildup. Think about it like plaque for your teeth, or on your teeth, but on your heart. Yikes. There's also congenital defects. So some people are born with funky valves, like bicuspid ones instead of the usual tricuspid, so usually 2 instead of the 3. There's also something called rheumatic fever, which is a rare post-strep complication, and as well as radiation therapy. It tends to be a side effect of certain cancer treatments as well. So basically, your valve is either born quirky or it slowly stiffens over time.
I see. And Abigail, what are the symptoms of aortic stenosis?
When your heart's working way too hard, your body lets you know. Some of the symptoms could be chest pain, pressure, getting winded just by walking upstairs or with simple activity, having dizzy spells or fainting, feeling extra fatigue, a weird cough that can sometimes be bloody, or if your heart is feeling like the beat is like a drum solo, beating really fast. And in your kids, if you're worried about them having aortic stenosis, you would look for trouble feeding, not gaining weight at a normal rate that they should, or getting tired very fast. All of these are basic signs that their little hearts are working way too hard. Early detection in kids is very crucial. Always speak up and talk to your healthcare provider if you feel like something's off with your little ones.
That's great advice. Sydney, how is aortic stenosis diagnosed?
Yeah, so there's a lot of tests that can be done. So that includes like an echocardiogram, which is basically an ultrasound of your heart. An EKG, or an electrocardiogram, is essentially like those annoying wires that they put with stickers all over your body to really just assess your heart rhythm. There's also things such as chest x-rays, a stress test, or like MRI, CT scans, which is usually just like a big image overall with different ways to contrast and really see what's going on. Or there's also cardiac catheterization. So it's a tiny little camera up your blood vessel. It's a little wild, but it's effective.
Yeah, that's fascinating. So what is the treatment for aortic stenosis?
Yeah, so it really depends on how bad it is. So medical treatment, even if you have no symptoms, it's highly recommended, especially if it runs in the family. But for mild cases, we would do regular checkups. Moderate to severe cases, you may need medications such as like diuretics or beta blockers to usually treat your hypertension, or usually in this case would be also known as your having high blood pressure. But if there's even more serious situations, it's going to really be time for surgical reinforcements. So there's things such as like a whole, like replacing the entirety of your valve, or there's a more minimal invasive cousin, known as a TAVI or TAVR, which is a transcatheter aortic valve replacement. So it's a tiny tube plus a new valve, basically fix that traffic jam that's happening in your heart.
And Abigail, what if you don't treat it?
If you don't treat aortic stenosis, that can be very bad news. Untreated aortic stenosis can lead to heart failure, permanent damage, or even death. So please don't ignore the signs and symptoms of aortic stenosis.
Good advice. Sydney, what is is this a genetic disorder?
Kind of. Let's break it down. So there's congenital aortic stenosis. So again, like we mentioned before, some people are born with it, especially if they have a bicuspid valve. So it's, again, the 2 flaps instead of the normal 3. This can lead to early narrowing and valve problems as, people age. It also ties in the family. So if mom, dad, siblings have had congenital valve issues, chances are a lot higher for you that it might be too. So early screening is really important. Especially if you're active or planning to do intense workouts. There's also what is known as acquired aortic stenosis. So unfortunately, this also can just develop over time. So it can be related to like age, calcification. So it's essentially your valves just start stiffening and with crusty, like with calcium. And then again, a complication with rheumatic fever. It's rare in the US, but it's still a thing. It tends to happen with any like oral procedures, and it can be just an infection that can lead to this whole cascade of other things. Bottom line, while it's not always genetic, just a family history is a big red flag for this. So if it runs in your bloodline, it's worth getting checked out early before symptoms start sneaking up.
Okay, thank you. Abigail, can aortic stenosis be reversed?
Unfortunately, it can't be reversed. Once the valve in the heart is damaged, it cannot undamage itself. But with modern medicine, there are a variety of treatments to keep your heart running smoothly.
Cool. Sydney, can someone with aortic stenosis still exercise?
So yes and no. So for more mild cases, it's definitely move your body. That's totally recommended every day, at least for 30 minutes. But for more severe cases, you definitely want to check in with your provider before hitting the gym. Usually people shouldn't be doing like any strenuous activities, since it can probably just worsen your aortic stenosis condition.
Okay. Abigail, does it affect the rest of your body?
Aortic stenosis does affect the rest of your body. It's not just a heart problem, it affects the whole body. Your whole body needs blood, and when the aortic valve is damaged, it is hard for the body to get enough blood that it needs. Less blood flow to the brain can cause dizziness or fainting, and when there's less blood to the muscles, oxygenated blood to the muscles, it can cause weakness or fatigue. And when your heart is pumping harder than it usually needs to, that puts more stress on your heart, which can cause higher chances of heart failure. Basically, your body is getting tired of fighting an uphill battle trying to pump enough blood to meet its needs.
Okay, that is great. Do we have any key takeaways?
Yeah, let's recap what we talked about. Aortic stenosis is narrowing of the aortic valve in the middle of the heart. It makes the heart work harder, leading to heart failure or major heart problems if left untreated. Causes can include age, genetics, and any previous illnesses. Some symptoms range from subtle fatigue to chest pain, fainting, or the bloody cough. So if you have symptoms, please reach out to your doctors to get any advice from them, and they can run tests if needed. It's diagnosed with imaging and treated with meds, surgery, or a TAVR. And unfortunately, it's not reversible, but it can be very treatable if treated early. Your heart works hard, so you want to make sure you take care of it.
Okay, and that's a wrap today on today's episode of The Healthy Beat. Remember, knowledge is power, and your heart will thank you for it. If you have any questions, drop them in the comments below, or better yet, talk to your doctors. Don't forget to like, subscribe, hit that bell so you never miss a beat, literally. Thank you.
Thank you.